Hello, welcome back to my channel. My name is Summer Wright, and today's video discussion is Mr. Stein's case study. Question 1 says, discuss what symptoms, behaviors, and stressors you believe are present. So with Mr. Stein, he is experiencing excessive worry, feeling like he's fixing to have a nervous breakdown. He is also experiencing lack of sleep, inner agitation and frustration, and he feels keyed up all the time. He's suffering with upset stomach and diarrhea over the past 6 months. He is also dealing with decreased concentration at work. His wife complains that he tosses and turns at night, and he frequently gets up to urinate. He's been very irritable within the past 6 to 8 months, and he has been yelling at people, even his little 7-year-old daughter. He's also been dealing with diarrhea as well. And at night, he lays awake worrying about work and what his future holds, how he's going to support himself and his family if something was to happen to his company, like if they went bankrupt. So those are some of the behaviors and symptoms that Mr. Stein is experiencing. So it says, what is your diagnosis of Mr. Stein? And I think that Mr. Stein has a generalized anxiety disorder. That is my diagnosis for him. He has experiencing all the symptoms of generalized anxiety disorder. So that is my diagnosis. And it says, based on the diagnostic features of your diagnosis, discuss how they apply to Mr. Stein. Well, like I said, he is experiencing some of the symptoms, excessive anxiety and worry that has been occurring for more days than not for at least 6 months. He's also experiencing worry, which is another symptom, restlessness, feeling keyed up or on edge, difficulty concentrating, which he's been having difficulty concentrating and stuff at work, irritability, which would explain why he's yelling and also yells at his daughter, and the sleep disturbances, which is like his wife said, he tosses and turns all night and gets up to use the bathroom frequently. They can also suffer with irritable bowel syndrome, which would explain his diarrhea. And then it says, discuss which modality you would consider using to help Mr. Stein and why. Well, I would do psychotherapy to help reduce his symptoms of the generalized anxiety, to be able to teach him skills to help manage his worries. There's also medication that he could use as well, like anxiety meds. So that would be another reason. And why I'll do that is to help him to lessen his symptoms of anxiety and to help him better cope. Cognitive behavior therapy would be another thing too. It's proved most effective for people with generalized anxiety disorder. So that was something else I would look at. Like the antidepressants that he could take to also help with his anxiety issues, or things like buspirone. It's an antidepressant that is typically takes several weeks to become fully effective, though. There's benzodiazepines that your doctor could prescribe to help relieve anxiety symptoms, but that's it's usually short term. But those are some of the things that I would use to help Mr. Stein with his anxiety issue, and hopefully be able to better help him to cope. So that is what I think would help. There may be other techniques out there that could be used, but psychotherapy is what the DSM-5 book has recommended. But cognitive behavior therapy is one of the ones that is the most effective. So that is what I would choose to help. I looked at other behaviors and symptoms in the DSM-5 to see if there's any other diagnosis that I could probably diagnose him with. And the only one that I've seen that really matches with Mr. Stein is the generalized anxiety disorder. So that is why I chose that diagnosis. So thank you for watching my video.